Hey everybody, it's Faheem, pharmacy prescriber, contractor, founder of Medlearn. Welcome to this video where we're going to be talking about how we're going to start to diagnose tonsillitis as part of the pharmacy first service. Now, please keep in mind if you're looking for a DPP or you're looking to get into your prescribing course or maybe open up a pharmacy, get in touch with us. Quick disclaimer, these videos are for teaching purposes only and not to be used for clinical decision making. And let's get into it. Okay, so tonsillitis. The term tonsillitis means inflammation of the tonsils. Now I'm going to make a bit of a drawing here to make this a bit easier for you. But this is someone's tongue, and we've got the tonsils that sit around just here at the back. And we have the uvula, which is there, and that's what we're working with here, the tonsil itself. And essentially, let's see, Farouk, can you pass me a red pen? Yeah. Farouk is having to move, which will move the camera. Yeah, okay, look. So, we're talking about inflammation around this region here. That's the region that we're talking about, that we're going to have some inflammation. And essentially, what would happen is that this is one of the common causes of patients who present with a sore throat. Not the only cause. We know there's viral causes, we know there could be a fungal cause, we know there could be bacterial. But this one, we're talking about bacteria. And the bacteria that's responsible is group A, beta hemolytic streptococcus pyogenes. This is the bad boy that can affect your tonsils.
Can you repeat it again?
Yeah, of course. The one here is group A, beta hemolytic streptococcus pyogenes. So this is the bacteria that can start to affect your tonsils and cause serious problems in the tonsils itself. Symptoms. So what are your symptoms going to be? Number one, patients are going to have sore throat. That's the first symptom. They're going to say the throat is painful, it hurts. And with that, you're going to have difficulty swallowing. When I have something to eat, solid foods, it's difficult to swallow, I don't feel like swallowing, you're generally feeling a bit unwell. Two, patients may have fever. So this is normally a fever, and we're dealing with adults here, or teenagers above 38 degrees, around that region, 38 degrees Celsius. That's what we're talking about here, okay? Some patients may have a mild grade fever, but the one that we're talking about here is going to be the fever that's around 38 degrees. Also, what they might find is that patients actually start to find pain around the neck region. And we're not going to go too much into the lymph nodes itself, but around this region. Patients will say it's painful around here, this sort of area. They can also say it's painful around the jawline as well, but mainly around this region. So we've got painful, let's say, neck. Patients may also be generally unwell. And again, not the best of spelling, but generally unwell. This is where patients will feel tired, they don't feel like eating too much, they don't feel well. These are the kind of symptoms that patients will present with. In terms of physically what you see, number one, you're going to see the tonsils. The tonsils will be red plus pus. So when you look at the tonsils itself, you may have white pus. They look angry, they look red. That's the key thing that you're looking for. So you're looking for these here, and you're looking for little pus that's around the tonsils. They may also have pus around the mouth itself, but that's what you're looking for itself. So that's the key thing that you're looking for. One thing I want you to remember is it shouldn't be that much swelling. It should not be that much swelling where this uvula moves to one side. That is where we start to get concerned. Let me explain it again. We've got the tonsils here. Imagine now that this tonsil becomes so inflamed, so swollen, that the little dangly part that we have in the throat starts to move to this side. So the picture will look like this. Let me draw it again. The picture will look something like that, where the tonsil is pushing here, and this is the center. You can see it's moved from the center. Okay? Look at this here. Everything, imagine this is exactly right in the middle. Everything is right in the middle. In the middle. Here, we can see that it's shifted to one side. What it should look like is that should be smaller, and the uvula should be one side, so it's deviated. So when you look inside someone's mouth, if you find that there is so much swelling, that the dangly part is being pushed to one side, that could be a sign of an abscess. If you've got a patient who starts to drool, that's a bad sign. If you've got somebody who says to you, look, I can't swallow, solids is okay, but I can't swallow liquid, that's a bad sign. If their symptoms are not getting better and it's been more than, let's say, 5-6 days, that's a bad sign. If they're immunocompromised, like they have a low immune system, they're diabetic, HIV, or have other pre-existing medical conditions, that's a problem. Maybe they don't have a spleen and so on. So keep that in mind, that the treatment is going to be based on knowing these features and when to refer. So some of your referral criteria, number one, is going to be signs of toxicity. So this is where the patient is becoming toxic now. So we're looking at, for example, septic. So their blood pressure is starting to fall, the heart rate's going high. This is not good signs. Number two, we're looking for drooling. So if this patient is drooling from one side, literally the saliva is coming out one side, they can't hold sentences, the swelling is spreading to other parts, or they're not able to speak full sentences, or they look definitely unwell. Again, be careful. Also be careful if they're immunocompromised. So they're diabetic, they have a low immune system, they don't have a spleen. These are things that start to become things that we want to worry about. In terms of differentials, of course, we discussed that in the last video as well, that there are many causes of a sore throat. We've discussed it before. Sure, you've got the tonsillitis, but what about glandular fever? Glandular fever. Now, this is a viral infection, and patients will have pretty much exactly the same symptoms as in tonsillitis, but they will also feel with muscle ache. They will feel tired. This will go on for more than a week. They may also have abdominal pain, and it's more common in teens, so you've got to be careful. Another cause of a sore throat could be just simple trauma. Could it be that they've had something hot to eat that's caused ulcers, or they've had some sort of physical trauma that's causing a sore throat? In that case, you won't find the pus that we see on the tonsils. What if they have a fungal infection? Again, with a fungal infection, you're going to have an oral thrush and you're going to see the white, but the tonsils are not actively going to be swollen. They may not have neck pain. Key things to remember. Okay, so these are just some of the other causes of a sore throat. There's plenty more. We know there's other ENT related conditions, for example, dental pain. But again, if they've got dental pain, the problem will be the teeth. It won't be the throat itself. They may have pain here, but they're going to come with the teeth. GORD, for example, let's say they're having reflux, and that reflux is bothering the throat. That could be causing the symptoms, but again, when you look inside the mouth, you're not going to see the swollen tonsils. The patient is not going to present with a sore throat. It's going to be problem with the chest. We discussed about heart problems, that some people can have pain in the major arteries. Again, they're not going to be presenting with a sore throat. You could have a symptom like sore throat, but it's not going to be that. Ulcers, another reason as well that can cause it. What if it's viral? What if it's a viral sore throat? Like we discussed yesterday about the coronavirus that can cause it, influenza virus, and so on. If it's viral, the key thing I want you to think about is cough. People who have viral sore throats will normally have a cough. They'll have a nose that's running. They might be sneezing. This is absent here. What do we have? We've got a patient with a fever. We've got pus on the tonsils. We've got pain in the neck. We don't have cough. We don't have sore throat symptoms. This is the key thing that we're seeing here. And remember, why we treat these patients with antibiotics is to stop them from getting a secondary issue or a bigger problem. Because this bacteria can release what we call toxins, bad boys. This bacteria can release bad boys. These bad boys are called toxins. These toxins can then affect the heart and affect the kidneys. That's why we treat with antibiotics. That's the reason why we treat. Otherwise, a sore throat itself will get better with time. If you eat well, exercise well, sleep well, your body can deal with it. The reason why we treat with antibiotics is to stop this bacteria from releasing toxins, which is poisons, that can then affect the heart and the kidney. Otherwise, patients will, even with these symptoms, if they have a good immune system, they're fit and healthy, they will recover. In the next video, we'll talk about how we can treat this, But these are the key things to remember. And as we go along with the series, we'll start to look into depth with some of these other conditions of the sore throat. Thank you for watching. I hope you found this video useful. Hey everybody, it's Faheem, farmer to prescriber, contractor, founder of Medlearn. Welcome to this video where we're going to be talking about how we're going to start to diagnose tonsillitis as part of the Pharmacy First service. Now, please keep in mind if you're looking for a DPP or you're looking to get into your prescribing course or maybe open up a pharmacy, get in touch with us. Quick disclaimer, these videos are for teaching purposes only and not to be used for clinical decision making. And let's get into it.